We went live with Epic with HealthLink in July of 2011. And what I found was that actually, to my delight and amazement, the physicians did extremely well with the implementation in terms of the documentation portion of Epic. What I think we're going to see over the long term is that as far as the patients are concerned, they're going to find that their physicians are able to get information much more quickly. So for example, no longer am I going to have to page through 20 pages of a paper chart in order to find a particular lab result or a report from a consultant. And I think that that's going to be a lot more satisfying for the patients. The other thing as well is that I think from the physician standpoint, what they'll find is that it will be a lot easier to really kind of track and see how they're actually doing when it comes to patient care. I've got a lot more data now that I can look at in terms of lab results, that I can look at in terms of medications, and how I'm doing as far as really managing and taking care of my patients' concerns. But I think the real payoff, we'll start to see it probably in about 6, 7, 8 months. I think that at that point, I'm going to have more information about individual patients, but also about my practice as a whole, that will help me get a better handle on how I'm doing with regard to patient care. The other thing, too, is that once the hospitals go live, I think then we're going to start to see the real benefits of having an integrated record in terms of being able to look at patients in all areas of care and to know how we're doing for them.